Hi everybody, this video of mine is about keloid scars. Although there are many types of scars, but in this video I am discussing specifically about the keloid scars. When a wound heals, it leaves a scar. A keloid scar is one that becomes thick, lumpy, raised and larger than the original wound. So what are keloid scars? A keloid scar is an enlarged, raised scar that can be pink, red, skin colored or darker than the surrounding skin. They can develop after very minor skin damage such as an acne spot or a piercing and spread beyond the original area of skin damage. I am posting different images about keloid scars so you can see how they look like. Okay, keloid scars are more common on the upper chest, shoulder, head, especially the ear lobe after a piercing, and neck, but they can appear anywhere. Anyone can get a keloid scar, but they are more common in people with darker skin, such as people from Africa and African, Caribbean, and South Indian communities. Keloid scars are usually shiny, hairless, raised above surrounding skin, hard and rubbery, red or purple at first before becoming brown or pale. They can last for years and sometimes do not form until months or years after the initial injury. Keloid scars are usually painless, but some can cause pain, tenderness, itchiness, a burning feeling, limited movement if located on a joint. So let me tell you what causes keloid scars. Experts do not fully understand what causes keloid scar, but they happen when there is an overproduction of collagen, that is the skin's protein. They are not contagious or cancerous, so that's a good news. If you have had a keloid scar before, you are more likely to get another. As I just mentioned that keloid scars can affect anyone, but they are more common in people with dark skin, and it is thought that they may run in family histories. They may run in family, so there might be a family history if you develop keloid scar. Younger people between the ages of 10 and 30 are more likely to develop them. Question may arise that can you prevent keloid scars? Well, you cannot completely prevent keloid scars, but you can avoid any deliberate cuts or breaks in the skin such as tattoos or piercings, including on the earlobes. Treating acne will reduce the likelihood of acne scars appearing. Avoid minor skin injury to areas more prone to keloid scarring, the upper chest, back and upper arm if possible. Now let me tell you treatments of keloid scar. There are several treatments available, but none have been shown to be more effective than others. Treatment can be difficult and it is not always successful. Treatment that may help flatten a keloid scars include skin camouflaging and some other techniques which I am going to tell you. There are a number of treatments are available if you have a scar that is painful, itchy or unsightly, or if it restricts your movement. Scars cannot be removed completely, but they can often be made less visible. Your doctor may refer you to a dermatologist, skin specialist or a plastic surgeon for treatment. Your GP can refer you to these specialized doctors. Okay. Some treatments such as laser therapy are not widely available on the NHS. I'm talking about UK. So you will need to pay for them privately. Okay. Now first treatment which I am going to tell you is skin camouflage. You can buy makeup that is specially designed for covering scars from pharmacies. It can be particularly useful for facial scars. If you have a larger area of skin to cover, and if you live in England or Scotland, the skin camouflage surface run by Changing Faces charity may be able to help. Your GP can refer you to the service in some areas, or you can refer yourself. Fully trained skin camouflage practitioner will be able to find a good color match for your skin tone and teach you how to apply the makeup. It is waterproof and can stay in place for 2 to 3 days. The skin camouflage service is not available in Northern Ireland and Wales. Okay. In some cases, for example, if you have a scar after having an operation or you have a disfiguring skin condition, you may be able to get camouflage makeup on the NHS. You should discuss with your GP. Second treatment option is silicone gel or sheets. These silicone gel or sheets can be used on healing skin, not on open wounds, to help soften and flatten a scar. They can also relieve itching and discomfort. To be effective, silicone gel or sheets should be placed over the scar for 12 hours a day for at least 3 months. They can be washed and reused. Ask your GP, dermatologist, or pharmacist if they can recommend a suitable silicone-based scar treatment for you. Third treatment option is steroids. Steroids cannot remove scars completely, but they can improve their appearance. Corticosteroid injection can be used to treat some keloid and hypertrophic scars. The scar is injected a number of times to reduce any swelling and flatten it. Depending upon the type of scar, the injection may need to be repeated. Injections are usually given on 3 occasions, 4 to 6 weeks apart, to assess your body's response. Treatment may continue for several months if the scar is improving. And there is another option, that is steroid impregnated tape, that can also be used to try to flatten keloid scar. It can be prescribed by a GP or a dermatologist and is applied for 12 hours a day. Then another option of treatment is laser therapy. Laser or light therapy, the pulses of light, can reduce the redness in a scar by targeting the blood vessels in the excess scar tissue. For some pitted scars, laser surgery, also known as laser resurfacing, is used to try to make the scar flatter. This involves using a laser to remove the top layers of skin, which stimulates collagen production in the deeper layers. But there are not many long-term studies to prove the effectiveness and safety of laser therapy. If you have laser therapy, make sure the person doing it is fully trained medical practitioner with experience in improving scars. Then the next option is cryotherapy. In this, liquid nitrogen can be used to freeze keloid scars. If cryotherapy is used in the early stages, it may flatten keloid scars and stop them growing. A side effect of treatment is that it can lighten the color of the skin in the area being treated. Then there is the option of dermal fillers, which are injections, often of a man-made acid, used to plump up pitted scars. Treatment can be costly and the results are usually temporary. Repeat treatments are needed to maintain the effect. Another option is skin needling, in which this involves rolling a small device covered in hundreds of tiny needles across the skin. This can also help improve the appearance of scars, but repeat treatments are often needed to achieve an effect, and results vary considerably. Then you may go for surgery. Surgery can sometimes be used to improve a scar by making it appear more natural, making it less noticeable by using a skin graft, or releasing a tight scar that is close to a joint to improve the movement. Scar reduction surgery is an invasive treatment that may not be suitable for everyone. You should carefully consider the pros and cons before deciding to have surgery, as well as the normal risk of surgery. There is also a chance of making the scar worse. If you are considering scar reduction surgery, make sure the plastic surgeon is fully trained and experienced in this type of surgery. You should fully discuss the procedure with your surgeon so you are aware of the risk and expected results. If surgery is used to treat a keloid scar, you may also need other treatments immediately after surgery, such as steroid injections or radiotherapy, to stop the scar growing back larger. Then there is the option of pressure dressing, which are usually used under specialist supervision for treating large burn scars or after skin grafts. The aim is to flatten and soften the scars. Pressure dressing are usually made from a stretchy elastic material. They are worn over the scar 24 hours a day for around 6 to 12 months. They can also be used with silicone gel sheeting to improve the appearance of scars over a longer period of time. Then there is the option of some creams. Vitamin E cream is sometimes recommended for managing scar, but there is no medical evidence to suggest it has an effect. But massaging a moisturizer like E45 into the scar will stop it becoming dry and help make it supple. You should also apply sunscreen to your scar, as it may be particularly sensitive to the sun.